Hey there, welcome to the channel. Party Popper, if you hit that subscribe button in the next 3 seconds, something amazing will happen to you in the next 24 hours. Don't miss out, try it now and see the magic. Sparkles, some people believe that exercise can harm kidney function due to fatigue and dehydration, especially if not done carefully. Intense exercise may temporarily increase blood pressure, raising concerns about potential kidney damage. However, this isn't entirely accurate. Moderate exercise and staying active can significantly benefit kidney health, even for those with kidney disease. For individuals managing kidney disease, heart disease, stroke, diabetes, or depression, regular physical activity plays a critical role. Staying active, avoiding smoking, and managing blood pressure and cholesterol levels are vital steps to protect kidney health and prevent further damage. In fact, maintaining an active lifestyle contributes to a longer lifespan compared to inactivity. The benefits of exercise for kidney health are numerous. Firstly, it helps lower blood pressure, a major risk factor for kidney disease. Regular physical activity improves circulation and supports healthier blood vessels. Secondly, exercise helps control cholesterol levels, reducing the risk of plaque buildup in arteries and decreasing the likelihood of heart and kidney disease. Thirdly, strengthening muscles through exercise is essential for overall well-being. Simple activities like walking, taking stairs, traveling, or shopping enhance physical health, improve quality of life, and allow for more time with family. Lastly, exercise helps regulate blood sugar levels, builds muscle mass, and burns fat, protecting against diabetes while supporting heart health. In conclusion, regular exercise improves quality of life and supports kidney function. Remaining inactive can lead to decreased stamina, making daily tasks harder and increasing fall risks. This is especially crucial for people with kidney disease who benefit from consistent moderate exercise. While moderate exercise is beneficial, it's important to avoid intense activities like marathons or long mountain hikes, which can strain the body. Understanding your limits and health condition is vital. Always consult your doctor before starting any new exercise routine to ensure safety and effectiveness. Monitoring kidney disease progression is key. If kidney function worsens suddenly, stop intense exercise and seek medical advice. Managing dry weight is also essential, especially for those on dialysis, to ensure safe exercise routines. Exercise plays a pivotal role in maintaining kidney health, particularly when managing conditions like blood pressure, diabetes, and heart disease. Balancing exercise with other health factors is essential. Regular physical activity helps prevent kidney disease, improves heart health, and enhances mental well-being. The key to effective exercise is balance. Workouts should suit your physical condition, and being mindful of limitations is crucial. Consulting a doctor can help tailor a safe and effective plan. Recognizing which exercises are appropriate ensures a routine that fits your needs. Maintaining a healthy weight and managing fluid retention are particularly important for those with kidney disease. Proper exercise helps achieve these goals. There are 3 main types of exercise for kidney health: aerobic exercise, strength training, and stretching. Aerobic activities like walking, cycling, or swimming improve cardiovascular health by enhancing blood circulation, controlling blood sugar, and boosting heart and lung function. Aim for at least 10 minutes of continuous activity, with warm-up and cool-down periods. Strength training maintains muscle mass and joint health. Simple exercises like push-ups, squats, or using resistance bands can build muscle and improve overall function. Stretching is equally important for flexibility and mobility, aiding recovery and preventing injuries. A balanced routine combining aerobic exercise, strength training, and stretching maximizes benefits. Start with lighter activities and gradually increase intensity. Always consult your doctor to ensure your exercise plan is safe and effective for your specific needs. For effective exercise, aim for 30 minutes daily, or divide it into shorter sessions if needed. Consistency is key. Exercising 3 days a week can provide significant health benefits. Strength training doesn't require gym equipment. Body weight exercises or simple tools like resistance bands are effective. Focus on large muscle groups with exercises like squats and lunges. Stretching keeps muscles flexible and supports joint mobility, benefiting overall daily life. Aerobic exercise is vital for cardiovascular health. Start with shorter sessions and gradually build up to 30 minutes or more, adjusting intensity to your fitness level. A mix of aerobic and strength training activities can provide comprehensive health benefits. Consistency and balance are critical. Begin with light activities that make you sweat and elevate your heart rate, gradually increasing as your body adapts. Avoid high-intensity workouts if you have kidney disease, as they may strain your system. Aim for 150 minutes of moderate intensity exercise weekly, divided into manageable sessions. Start slow, avoid overexertion, and choose the right time for workouts. Mornings or evenings are ideal. Avoid exercising immediately after meals or before bedtime. Stop exercising if you experience dizziness, chest pain, or other symptoms. Consult your doctor before resuming exercise after illness or changes in medication. Diet plays a crucial role, and specific guidelines depend on the stage of kidney disease. Early stages may require limited protein intake, while later stages or dialysis patients may need higher protein. Avoid high potassium foods if levels are a concern, and consult a healthcare provider before using supplements. Exercise helps manage kidney disease but must be balanced with proper care. Regular moderate activity reduces stress, boosts energy, and supports overall health. Starting small and gradually increasing intensity can improve your quality of life, supporting heart health, mental well-being, and daily activities. In conclusion, regular, moderate exercise, combined with a healthy diet and medical care, enhances kidney health and overall well-being. The goal isn't athleticism but staying active, feeling better, and living a healthy